We have to be ready for anything at all times. If we have traumas, it makes it so much easier just to call the specialist. One click, and they're there.
Previously, we had to wait for the anesthesiologist to get their schedules done, the OR to get their schedules done. Now it's all in one place, so the moms can deliver here.
Before Petal, we were spending a lot of time on manual tasks and manually creating schedules. Since Petal, we have spent almost no time on the manual tasks that used to swallow up our time. My name is Dr. Roger Musa. I'm the Chief of Staff at Stevenson Memorial Hospital. I'm responsible for the professional staff. Every morning I come into work and I go straight to the hospital dashboard. The hospital dashboard shows me every department. And we do have every department in our hospital on Petal. I'm also a hospitalist, so I work on the ward. I get to see firsthand how our tools function in our hospital.
Prior to the implementation of Petal, each department did not have access to the other various departments' schedules. I'm Jackie Cameron. I work at Stevenson Memorial Hospital. I support the Chief of Staff and all of the physicians within the Medical Affairs Office and Professional Staff Association. Our emergency department has been utilizing Petal for at least 5 years now. I was spending probably 2 hours in a day to put all of the schedules together into one spreadsheet so that I could share it across the hospital. Now it takes me about 20 minutes, which is a beautiful thing. And because we have the hospital dashboard, everybody has access to see who's on call.
Before Petal, we had to type up 2 lists. We had to distribute all of the lists to each of the floors, leaving our department unattended. So this Petal, the fact that every staff member can open it up and read who's on call, who's the OR nurses, who they need to get, is huge. It's time saving for the team.
A tool like Petal helps us focus our energy and our time on things that matter, instead of wasting time on administrative tasks that don't impact patient care. We also didn't have a way of securely messaging each other, so the clinicians were not using secure platforms. And that's a liability in itself. This is where Petal was a natural fit.
For an emergency doctor, we can have anything. We have to be ready for anything at all times. We can have really busy days where we have a lot of volume of patients. We can have trauma patients. We can have lots of ambulances. Going just from the ER usage to the entire hospital, before we could just see who was on call for the ER, but now we can see who's on call for all of the departments, and it just streamlines the processes and workflows so much better for us.
That's so important because if you have a gap in anesthesia, for example, it affects general surgery, it affects OB. The fallout of even one gap in coverage is monstrous, especially in a small community hospital like ours, where there is no redundancy at all. So the less time I'm spending on administrative tasks, the more time I'm spending with patients. And that's where our time should be spent. That's why I became a physician in the first place. I would recommend Petal to other hospitals. In fact, I have recommended Petal to other hospitals. I think it is a game changer for hospitals that are looking for an all-in-one platform that can help with scheduling and transparency, efficiency, and even secure messaging.